Now both these graphs here represent summation. This, on the other hand, is a simple muscle curve. So this is what we looked at earlier, wherein you apply a stimulus and you get a muscle twitch. And then while the muscle is relaxing, you apply the second stimulus and therefore the muscle goes into the next contraction. So this is one sort of graph, but sometimes the second stimulus may fall in the contraction period instead of in the relaxation period. So if you look at this graph, the second stimulus is falling in the contraction period. So the muscle is not at all relaxing. It is directly going into the next contraction. So actually, in this graph, there are two muscle twitches fused into one. We are not able to make out the difference because the second stimulus is given during the contraction period, whereas here you can make out two distinct waves. So this is a simple muscle twitch, which is the result of a single stimulus. This is summation when the second stimulus is applied in the contraction period. And this is summation when the second stimulus is applied in the relaxation period. Now, apart from summation in a single muscle fiber, the other mechanism by which the skeletal muscle increases its force of contraction is by progressive recruitment of motor units. So initially, when the nerve signal is weak, it is the smaller motor units which respond. But as the signal gets stronger, the larger motor units begin to respond. So over time, there are more and more motor units responding, and the larger units have a much larger contractile strength as well. So now, overall, the muscle has a powerful contraction because of recruitment of many motor units, including large motor units. So in a sense, the frequency of the action potentials is an important determinant of the force of muscle contraction. More the frequency of action potentials, greater will be the summation, and therefore greater will be the force of contraction. Now, at a given point in time, all the action potentials do not arrive simultaneously at the muscle. This means that all the fibers are not contracting at the same given time. So on an average, only about 1/3 of the muscle fibers would be contracting together at once. Now this is a protective mechanism. It prevents damage to the muscle tissue because otherwise the entire muscle may go into contraction at once and bring about a very powerful contraction, and this may not even be necessary in that circumstance, and it can cause damage to the muscle. So this is a protective phenomenon. So to recap, how does a muscle bring about increase in its force of contraction? So the first mechanism is through summation. When the frequency of action potentials arriving at the muscle fiber is increased, there is summation of contractions, and that results in increased force of contraction. So this is one mechanism. The other mechanism is through recruitment of more and more motor units. Now, initially, the slow oxidative fibers are recruited first, and this is followed by the motor units which have fast oxidative fibers, and the fast glycolytic fibers are recruited last. Now, we've already looked at what the response of the muscle fiber is when two successive stimuli are given. So we looked at beneficial effect, where the second curve benefits from the first, meaning that the peak of the second curve is higher than that of the first curve. So when you give two consecutive stimuli, there could either be summation as with this graph, and this is because the second stimulus has been given during the relaxation period of the first curve. Or you could have superposition, which is what you see here, because the second stimulus is given during the contraction period of the first curve. Now, what if instead of 2 stimuli, we give multiple stimuli? The outcome is either tetanus or clonus. So, if every second stimulus is given in the relaxation period of the preceding curve, then you get clonus, which means that each time the muscle begins to relax, but then again goes into contraction. Then it begins to relax and goes into contraction. So you will see this visibly in the muscle in the form of jerky contractions because the muscle is not relaxing fully. But if you look at tetanus, each subsequent stimulus is falling in the contraction period of the previous curve. Therefore, the muscle goes into sustained contraction without relaxing at all. And that is what is meant by tetanus.